Alright guys, like I was saying, now the dorsal branches, these guys, they run under the tendon, right? They run under the tendon. They run under the tendon of what? The flexocarpal ulnaris. The tendon of what? The flexocarpi ulnaris. Okay. When they do that, this particular this particular what nerve are then taken or they reach to what the dorsal surface of what the hand. They reach the dorsal what surface of the hand. Okay, once they reach the dorsal surface of the hand, what happens is that what they divide into what is known as what the dorsal nerve, guys. Normally there are 3 of them, but the later become what 5. You understand? Dorsal digital what nerve. So this dorsal digital nerve, what they do is that what they innervate the medial surface of the hand. You understand what I'm saying? And also they innervate they innervate what these guys, the medial aspect. I mean what aspect, yeah. Medial aspect of the hand, right? And also they also innervate the dorsal surface of the fourth. Okay, let me use dorsal aspect, yeah, dorsal surface of the fourth and what fifth what finger. Serious, exactly. All right. Okay, now the second branch is called what? The palmar branch. The palmar branch. But this guy runs. This guy continues in the ulnar groove, guys. People groove every day anyway. In the ulnar groove. You understand? When it runs in the ulnar groove, upon reaching the pisiform bone, guys, pisiform bone, it's split in the pisiform bone into a superficial and a deep branch, guys, and a deep branch. Okay, now talking about the superficial branches. As we all know, this particular superficial branch, it supplies the skin around the hypotenuse muscle. Your hypotenuse muscle is supplied by the superficial branch, but for the deep branch, you understand, it supplies with the deep layer of the palm. You understand? But the superficial branches, it divides into what is known as the proper palmar digital nerve. Yeah, exactly. Which also supply the medial aspect of the hand, guys. Medial aspect of the hand. Alright. Okay, now look at this. Let's take a good look at this one again. We talked about the dorsal branches. These dorsal branches, we've known that these dorsal branches, they run under the tendon of the flexocarpal ulnaris, which now after running under the tendon of the flexocarpal ulnaris, they go to the dorsal surface of the hand. There they now divide into the dorsal digital nerve. Understand? Now this dorsal digital nerve, they give an innervation to the medial aspect of the hand, as well as the dorsal surface of the fourth and the fifth finger, guys. Alright, now the palmar branch on the other hand, you understand, this guy continues running and in the ulnar groove. When it runs in the ulnar groove, when it reaches the pisiform bone, guys, when it reaches the pisiform bone, you remember it's a kappa bone right here. When in the when it reaches the pisiform bone, you understand? What happens is that at this level, it now divides into a superficial and a deep branch. Understand? Alright, talking about a deep branch. This deep branch normally it runs around it runs around the palmar arch, basically. The deep branch runs around the palmar arch. Yeah, palmar and arch, right? Basically. Okay, now. And this particular branch, usually what gives innervation to the deep palmar surface, guys. The deep palmar surface. Okay, now talking about the superficial branch. This superficial branch, as we know, it divides into the proper palmar digital nerve. Understand? And this proper palmar digital nerve, they give innervation to the hypothenar muscles. You understand? Your hypothenar muscles, they are innervated by the superficial branches of the superficial branch of the palmar branch of the ulnar nerve, right? Exactly. So of course, if there's any pathology that is affecting this nerve, what do you expect? You expect also clinical manifestation. You understand? In this particular aspect, you see a patient the patient will be experiencing functional impairment, right? Yeah, exactly. That's one of it, of which we are going to look at the clinical anatomy of the whole brachial plexus in a jiffy in the next lecture, basically. Okay, now let's go into the next nerve. So it's a very nice nerve. It's called the radial nerve, guys. The radial nerve. Seriously. Okay, now we got the radial nerve, guys. Radial nerve. Okay. This guy here, the radial nerve. The radial nerve comes from the lateral cord, right, guys? Lateral cord. That's the origin. Trust me, that's the origin, guys. Okay, now this particular radial nerve, just like we usually describe the topography. We usually describe the topography based on the regions. You understand what I'm saying? Yeah, exactly. Okay, this particular radial nerve in the arm. What happens to this guy? Okay, you know that in the arm we have called a radial canal, right? Yeah. Radial canal. And this radial canal, that's where the radial nerve runs. But in this canal, we have what we call the deep artery of the arm, right? Yeah. Deep artery of the arm. So the deep artery of the arm, together with the radial nerve, they run together in the radial canal. So now, the radial nerve escaped this particular radial canal through a space that is found between the biceps brachii, and the brachioradialis, guys. And the brachioradialis. So after escaping this canal, you understand that this particular nerve finds its way to the cubital fossa, guys.